Okay, good morning everyone. Thank you for attending. If you heard my talk on, who heard my talk on Wednesday? Okay. I'm going to try to recap a few points on Wednesday. I'm not going to get too much into detail. If I have time at the end, I'll try to recap more in depth. On Wednesday, what I tried to cover was how to see differently, understanding long-term ideas of fat grafting and safety. I'm going to address a very, very small part of that this morning. I'm going to principally talk about how to do it. And I think as surgeons, in order to understand how to do it, you have to have video. So this course is about half video. All this video is original. You're the first people to see it other than myself. So this is actually for a book that I wrote about a year and a half ago, but never came out just yet. So you'll be the first people seeing it. And so I want to talk first about how to see, because if you don't understand how to see, you cannot transplant someone. Can everyone hear me okay? Yeah? Okay. So if you look at Sharon Stone from her 20s to her 40s and you ask again here, how is she aged? We look at this and we think it's totally gravity. But if you look at the brows, you actually see that this height is almost the same as this height, if not maybe even slightly higher. This one is almost the same height. And the skin may have come down about 1 millimeter here, but it's actually gone up maybe about 1 or 2 millimeters here. So what we think is gravitational is absolutely, in my opinion, not. It's just hollowness. There's more bone. And if you start to compare old photographs of a patient, you'll start to see that the brows have not fallen in the majority of patients. It's just become flatter and hollower. So what looks like you need a brow lift, you need a facelift, you don't really, in almost 98% of cases. So this is a reductionist model to help communicate. I'm always into not only communicating with you as physicians, but also with your patients, right? Because your patients have to understand this. So I always say when you're young, you're a grape. As you get older, you become a raisin. But why should you take that raisin and pull and cut and stretch it into a pea? Because I always say a pea does not look like a grape. A grape looks like a grape. So in other words, people are not looking like themselves after extensive lifting procedures. So we have to take a step back and wonder, are we doing the right thing? And the best way to convince you, because you have to be convinced before you can convince a patient of this, right? Because if you don't believe in it, a patient won't either. So take a step back and help a patient understand this. Ask them to go back and look at the old photos. Yes, sir?
Good morning.
Good morning.
To interrupt that early. It's a very strong hall in here. Could you try to get it a little bit away?
Yes.
Maybe we will have difficulties after an hour.
The sound. Yeah, I figure I heard a little, thank you. Let's try this. It was up here to begin with. Is this better? Thank you, thank you. I heard that too. I was wondering about that. I appreciate your input. Any other feedback, please let me know. So is this what we want, a baby face? No, it's not what we want. So understand, sorry, I hit the wrong button. Understand that the way to look at aging is fat loss from birth to death. That's it. It's very simple. Yes, we accumulate rhytids, we accumulate maybe some gravity of the neck, maybe some other changes, hair loss, skin changes. But principally, the mechanism of global facial aging is volumetric collapse. And if you think about it, if I ask most women when they like themselves the most, men can be a little later in age, women usually tell me around 30 to 32, not 20 to 21, because there's a lot of baby fat on the face. And so it's a linear loss of fat. So baby fat isn't a unique entity, it's just loss of fat from birth to death. So you saw this on Wednesday for those that attended, is a new paradigm of understanding aging from volume changes. So when you look at a 10-year-old, a 20-year-old, you instantaneously can see how their ages based on the shape of their face. They go from a full circle, and that circle eventually becomes a triangle, and then as we start to lose volume and the lower face starts to dominate, perhaps with some metabolic changes as we gain some weight in the lower face, we start to become more square, and then the triangle starts to invert. So the question is, where is the perfect age? Is it a 20-year-old face? And remember, you're trying to take care of the patient, and most patients don't want to look round. So it's actually probably around 30, and it's a concept I like to think of as an oval. The ovalization of the face to me, is perhaps the most attractive, which is 30 to 32. And if women go back and look at that, they see that. Men sometimes is a little bit older. Men sometimes look better with some wrinkles and a little bit of volume loss. Okay, so let's start with, to me, probably the most important area in terms of volume. It's probably the easiest area to do as well, is the cheek. The cheek, to me, is divided into two areas, and we'll go into more specifics in a moment. The anterior cheek is where the malar ligament is, the anterior depression, and the outer cheek, the lateral cheek. Those are the two components of the cheek. But as we go also down, there's a buccal component as well. And that buccal component is part of the cheek. If you just build the cheek up and you don't build the buccal area and select patients, and we'll talk about patient selection in a moment, then you're going to have too big a cheek. It won't blend and balance. So the art of a fat transfer is not just targeting one or two areas. It's targeting multiple areas so that you create overall balance to the face. And then this is what I call the upside down U, a terminology I came up with to explain to patients, because most times when people are looking at the lower face, they're focused on a mandibular, they're looking at a marionette line or a jowl. But what I want you to do today is to teach you to see negative space, something that's absent. So what I see is that the chin starts to stick out as we get older, and the anterior chin starts to hollow out. And I'm not just talking about the mental sulcus, it's not lines. We're too fixated on folds and lines and things. We're talking about an absence of tissue where the bone begins exposed here, and also right in the prejowl sulcus. So this continuum of a U, to me, is very important, because overall what it does, when you fill all those little components, you create an overall oval. And what you may have heard me say on Wednesday was a concept of blink. There was a book by Malcolm Gladwell, which is, we judge each other instantaneously in a blink. So my goal is to help people see each other look better at 5, 10, 20 feet away instantaneously. You can look at that person and say, wow, they look good. That's the blink, and that's by creating improvements in multiple small areas of the face. So then overall, for this 49-year-old lady, you can create a lot of small changes that look better. Okay, let's go back and focus on the buccal again. Is it just putting it right in the center? No. Well, the most obvious is the center area where there's a central depression. But the buccal area is more complex. I usually look at it in about 85 to 90% of people as what I call two thumbprints, which is when you start to look at people in a three-quarter view, you can almost take two fingers and put it right here. There's one in the center, and there's one right below the zygomatic arch across here. And those are the two areas I tend to target, with the principal area being the center, and then a little bit more toward the side as well. Those are the two areas that almost everyone universally could benefit a little bit. Not everyone, but most people. And then a third area is toward this where the loss of dentition, if someone is losing a lot of teeth as they're getting older, the maxilla is being lost, there's a little soft tissue hollowness here, as well as for someone over 60 that maybe doesn't have great dental hygiene. And so there are three components. I call it the medial buccal hollow. These are just my terms that I've come up with as I began to see. So this lady here is 16 months after a single session of fat transfer. She had fat grafting into the brow upper eyelid, which we'll talk about more in a moment, the lower eyelid tear trough, the anterior cheek in a confluence to the central buccal area. Her outer cheekbone I blended and covered, and I went underneath the arch of the zygomatic region as well to blend that in. The anterior chin, you can see that upside down U of vacuousness sort of arching across. I'm so sorry, the photos are hard to see here. At the end, if you want to come up and see my photos, I'm sorry, it's a little dim. I can really see it well here, but somehow it's not picking up too well there. So it's across the anterior chin, really helps a lot to blend it in. And also, I believe that fat is not an effective instrument to fix the folds very, very effectively, but it's an area that, in her case, seemed to help a little bit. Again, I'm sorry the photos are not turning up as well as I would like. That one's a little bit better. Okay, so this lady had multiple small procedures done. We'll talk more about what they are in the context of the eye. But in the buccal area, she's actually quite wide, so you want to be really careful in the buccal zone. I put a drop, maybe less than a cc, into the central buccal zone so it blends the cheek into the fuller lower face. And again, anterior chin work to almost draw the face forward. So this is a very, very conservative buccal treatment. This lady had no buccal treatment, and so it looks like I did liposuction or a facelift, and I did not. I added volume to the anterior chin, the upside down U, and the central anterior cheek, nothing on the outer cheek, nothing in the buccal, and what that's doing is it's creating an illusion of drawing your eye forward to actually narrow the face, and so that's part of the art of understanding it.